Hello everyone, my name is Delilah, and in this video I'm going to be sharing my endometriosis diagnosis story. I'll be honest, this isn't easy for me to talk about. There's a lot of fear in being vulnerable and talking about something so personal. I haven't even told very many people what the last few months have pretty much looked like and felt like for me in general with all the anticipation. It is such a misunderstood topic. I'm just going to throw that out there from the beginning. And if you know, it gets really hard to explain it to so many different people because it is a condition that you don't really hear a whole lot about unless you personally have experienced it for yourself or go searching or researching about it. I've realized that by not sharing this story, it doesn't really help others who might be faced with the same challenges I find myself in today. I also don't want to miss the chance to connect with others who might be feeling the same way. I have been feeling severe symptoms like for about 8 years now. As a matter of fact, I recently went through surgery on January 2nd. I've been recovering. Yesterday I had it was a little bit over 2.5 weeks, almost 3-week post-op. And I feel so much better. Pretty much took the last few months to prepare for this, to regroup, to gather my thoughts, to gather my feelings, to do the necessary work in removing things out of my life and implementing things that just helped me, like with my mental health, my wellness, and just well-being overall. It really took time for me to just focus on myself, focus on my mental health and my well-being throughout this entire journey. Just recently preparing for the surgery, it felt like an endless battle, a lot of confusion, misunderstanding, as well as facing fears of my potential future and what that would look like down the road. I'm a huge believer in holding the faith as well as challenging the narratives. So I'm so hopeful and I'm really excited to share this story with you. So I'm going to bring it all the way back to when it began. Obviously, hormonal fluctuations for women. When we initially get our periods, it starts at a really young age. I was 12 years old. I want to say that my periods started to get really painful in my teen years, but some of us from an early age are conditioned to suppress our emotions and our pain, to mask it, right? To deal with it, to not let it stop you from functioning in your everyday world. For so long, I was told that what I was experiencing was completely normal and just common pain. It was introduced and packaged like, welcome to womanhood, and that I had nothing to worry about. I was told the answer to all my concerns would require me to get on birth control immediately because that was what was going to solve it. At that time, I did not consider it. I got married 2 weeks after my 20th birthday, and I did not want this to prevent us from potentially having the chance at pregnancy if it did happen. So I was 20 years old when the pain got severe enough for me to start like a little investigation, like, is this normal? Let me go figure this out, right? At around the same time, my first primary care physician assured me that it would go away all on its own. The pain would subside and that I was really young. I had nothing to worry about. My first initial response was to just trust them since they were the professionals. But I did leave there feeling kind of like she didn't really understand the level of pain that I was already enduring. I definitely told her that the pain was just like crucial. It was a lot for me, going to work around my period. It would get so horrible. However, the one thing that I am glad I did at that time was get a second opinion. It was the same thing, except they recommended surgery to figure out what it was that was underneath the surface. I was told that I was still too young and it wasn't necessary, and I didn't want to go through a big surgery, take time off work, and stop my life for this pain that was just, you know, normal. For years, normal has been used to describe all my abnormal symptoms in terms of exams, labs, basic procedure. Everything kept coming back normal. My hormones were normal, but the pain was so bad. I just couldn't figure it out, and no one was really giving me answers. So I'm not going to lie, I kind of felt like a dramatic and weak person for acting like the pain was bigger than it was, even though it was horrific. I just thought I could just manage with Tylenol, and I don't want to get too far ahead of myself. Finally, in 2017, I was diagnosed with dysmenorrhea, which is just another fancy word to say that you have severe menstrual cycle pain, where you experience intense pelvic pain. For me, it was extremely debilitating. Sometimes I could not get out of bed for a while. Sometimes I would curl up in the bathroom at work just in hopes that it would subside. It wasn't just extreme pain during my actual period. It was more like all throughout my cycle, later around ovulation, over the years. Other symptoms I experienced were chronic pelvic, back, legs, abdomen pain that would literally keep me in bed for the first 2 days of my period. Pain with bowel movement to the point of having to like grip something. Extremely heavy periods. I've experienced infertility for about 8 years. Chronic fatigue and constant feeling of severe sweating, bloating, and just inflammation and bloating that just, it would intensify during ovulation all throughout my period, all while being told that this is normal. And of course, anxiety and depression due to the inability to comprehend what was happening and what felt like no one close to me understood, and the effects on my daily life overall. I remember on multiple occasions having to call out of work every month during the first 2 days of my period. And of course, as women who have a menstrual cycle and still have to show up and, have work to do either way, I would force myself to just endure the pain. I remember on several occasions taking Vicodin just to make it through the day at work. No exam, no lab, no MRI would ever tell me anything. And I just kept getting like, maybe it's constipation, maybe it's this, maybe it's that. And I had not struggled with constipation, so that didn't make sense for me. My symptoms were very consistent, but I didn't have all the symptoms of endometriosis for them to assume that that is 100% what it could have been. With that being said, I had all the exams, all the labs, all the CT and MRI scans, but nothing was giving me clarity from or relief from worrying what it possibly could have been. Later in 2023, I had more exams and labs. They also checked my thyroid hormone levels and all of the things. Everything as expected came back normal. But finally, July of 2024, I had this crazy pain that just kept shooting like up my rectum, and I had never experienced that before. It really frightened me. I ended up going back to the emergency room for them to tell me that nothing was found. So you can only imagine how frustrated I had been. Frustrated for so many years, just constantly getting as good as it was, it's like good news, but bad news. Good news, like you're fine, everything's normal, there's nothing majorly wrong with you. But the bad news is like when you don't have clarity on your symptoms and what you're feeling, but you know that they're there and the pain is so severe, and you know that it's just not normal anymore to feel this. Like it was starting to get really, really intense to the point where like I could be walking and like drop from the pain. In October 2024, so last year, I started having even more intense abdomen pain, different from anything I had ever experienced before at this point. I reached out to my PCP and he recommended I go directly to the ER and not wait. At the ER, after waiting 8 hours in the waiting room, I was simply diagnosed with generalized abdominal pain. After 8 hours, I was in the hospital for 8 hours. And of course, there's that relief that there's nothing noticeably wrong, but also frustrated because was I supposed to just endure this pain? I reported back to my PCP and he assured me that he would refer me to a gynecologist specialist who would reach out to me. I just love when doctors do their due diligence because he kept pushing forward. They didn't call me for a while. It had been like a few weeks at this point, but I was starting to get really persistent because I wanted more answers. I really wanted to start this investigation and just figure out what the heck, like, I'm just going to face it all and just figure it out, do my due diligence. It's amazing. This particular doctor became my doctor in 2023, which is amazing because he moved the pin forward so much faster than any other previous doctor that I had. And it was just up from there. It was just incredible. He said to me, if you do not hear back in 2 days, call me. I quickly got called almost immediately, like within just a few days, saying that the specialist had a cancellation and wanted to consult with me. For some reason, on the day of my consultation, they had to cancel my appointment and reschedule it. But I was able to get in the very next day with another specialist. Looking back, I could not be more happy that I ended up seeing this man. For the first time throughout this entire painful journey, I finally felt completely heard, honestly believed and supported. And I had even more hope than I ever had before. He looked through my entire history and all of my records and saw the consistent visits that I had at the hospital. And he assured me that what I was feeling was no longer normal. Mind you, this was 8 years after first PCP told me, don't worry about it. And then I got a second opinion. And then I was told I was too young. I didn't have to go through the surgery if I didn't want to. And so I didn't do it because they're not going to force you to do anything if they don't have to, if it's not life-threatening, right? So at this consultation with my gynecologist specialist, I was assured that my diagnosis was dysmenorrhea and infertility until further notice. That was just the diagnosis that I got. And so obviously I already knew I was dealing with the pain. And now the new issue was infertility because at this point I had not been able to conceive. He suggested we'd move forward with the laparoscopic surgery to further investigate my issues, to just get it done, go in, take a look at everything, and to see how severe it was. What came as the biggest surprise, my specialist had a cancellation for surgery on January 2nd of this year. And I was scheduled as his first patient that morning. I'd undergo surgery for a diagnostic laparoscopy with a robotic-assisted resection of endometriosis if found, as well as chromal perturbation, which is a procedure used to check if the fallopian tubes are open and working properly, which is everything that I had hoped and dreamed. I should have done it a long time ago, but this doctor gave me more information on why it would be the golden standard for this type of level of pain. So I was going in for a diagnostic laparoscopic surgery with resection and removal of endometriosis, evaluation of my entire pelvic area and even up in my intestines. all around pretty much. This approach is often considered for severe and deeply infiltrating endometriosis when all other options seem to fail. So now I'm here with so much anticipation, anxiety. I am freaking out because I have no idea what is going to be discovered. The level of pain that I was in was so severe that I honestly, not that I expected it, but it was in the back of my mind. This isn't going to be good, because I was pretty sure that the level of pain that I was feeling wasn't going to be a situation that was going to be like a mild case or even a moderate case. I was pretty sure that this was going to be a severe case that had some future things that would pretty much alternate my entire life and what my future would look like. I definitely tried to stay off of the media, reading things, or even listening to other people's stories, because I had ran into one and I was like crying on the floor, praying to God, like, let this not be my situation, because I was pretty sure that it was not going to end up being how I had anticipated. So I went through surgery on January 2nd, right at the very beginning of the year, just trying to face my fears. A specialist had a cancellation and I was like, book me, like, let's just go. Let's just do this thing. Let's just go for it. I just really wanted to get ahead of it, face the fear and the potential future, what it would look like. I just wanted to go for it. So I'm a little bit over 2.5 weeks and I am feeling so much better. The surgery itself was minimally invasive, which wasn't as bad as I thought, scarring wise and incision wise, but the amount of pain that I experienced was out of this world. Like, the pain that I experienced literally had me seeing stars. And I had felt like I was going to faint so many different times days later after the surgery, especially from all the gas and CO2. I was on Oxy and also 800 milligrams of ibuprofen. And I was also on a nerve relaxant, which was a lot of medication. But after my first week, I thought that I could kind of wind myself off of these things. And I made a mistake by prolonging my medication, and the pain was just horrific, out of this world. I felt like my ovaries were going to rupture. But everyone is so different. Anyway, I had my post-op and I have reviewed my results with my specialist. And I can't even begin to tell you how grateful I am to be standing feeling so much hope, and honestly just wanting to really press in to having a hopeful future and just doing everything in my power to take care of my body, my well-being, my mental health, and removing toxins out of my life that I had already been working on for the last 2 years. So I'm going to read my post-operative notes from my doctor. I had a diagnostic laparoscopy with resection of endometriosis, as well as the chromoperturbation, which is where they test out your fallopian tubes and ovaries. So complete inspection of the abdomen, pelvis revealed stage 2 endometriosis. There were endometriosis implants on the posterior cul-de-sac, left sacral ligament. There was old scarring noted in the left broad ligament on the posterior side. There were also active endometriosis implants in the right ovarian fossa. There was a small superficial implant on the rectal mucosa. So they have revealed that it was stage 2 endometriosis. They did remove where they found it, and I couldn't have been more happy that I finally got clarity. I finally got something. I finally got some type of answer for all of the pain and all of the chronic fatigue that I was experiencing. Not only just my lifestyle and everything that I have been doing and just like busy, 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 always, all the time, not giving myself, the proper rest and the proper nutrition half the time because we're constantly on the go and we're trying to like hurry up and scarf whatever we can down our throats. And we're constantly overwhelmed by everything. And honestly, it really took me time to see that I was operating at a level that was no longer sustainable for me. At this point, before I met my new specialist, I was at a point where I was at a complete depleted state, and I had cut out things out of my life, and I was starting to feel better. To say all this to say, with endometriosis, there's not necessarily a cure, but there are things that you can implement in your life that could help keep symptoms at bay. Endometriosis is a disease that affects an estimate of more than 1 in 10 women across the globe. 1/3 of us suffer under immense pain. The crazy thing about endo is that pain and stage level does not really correlate, meaning you could be at stage 1 and have the most horrific chronic pain, or you can be at stage 4 and not have pain at all. Endometriosis, although common, often goes undiagnosed, emphasizing the need for more awareness, more research, and better holistic treatment options. So that is my endometriosis story and how I got diagnosed. Finally, after an excruciating 8 years and not really knowing what to do or what was best for me, I just gave in to the idea that it would go away, that I just needed to eat a little better or work out a little bit more. And we know now that endometriosis is an immune systemic condition that affects your whole body. Endometriosis is not just found in your pelvic area. It has been found in many organs in the body. And when left untreated is when you run into more severe cases. So while it can be challenging to continue to embrace a positive spin on something potentially devastating and painful, changing your perspective and perception of what you're facing can definitely foster strength and even more resilience. If this is you, you've done some hard things before. This won't be any different. You've been through so many challenges. It will be like anything else. And I have to choose to remind myself that it's gonna be okay regardless. I hope my story somewhat help you understand symptoms that come along with endometriosis. And I'm just gonna say this because it's something that I really, at the end, felt like I had to do, was finally listen to what my body was saying and further look into it and ask the questions and not be afraid to take that next initial step to figure out what is actually happening in your body. I believe that we are all capable of tuning into our inner knowing and our inner intuition. And sometimes we do get a little bit here and there, and we don't always follow it full-heartedly, but we can take little steps that will eventually add more clarity and more direction for our lives when handled the right way with the right providers. And the last thing I'm going to say is to please follow me on Instagram as I continue my journey in wellness and holistic nutrition and working out and just all the things that require us to be aligned within ourselves in a healthy state so that our bodies can recover faster. If you've gone through so many challenges before, why on earth would you think that you could not conquer this one too? Feel free to leave a message or drop a comment if you have any questions. I'd love to answer it, and I'd love to hear your story if you have had similar struggles and have found a way to navigate through this condition that affects so many women. I cannot express this anymore. Please take the time to care for yourself, for your well-being, Being chronically fatigued is very normalized in society today, but it is not normal to operate that way in the long run. Thank you guys for hearing my story. Talk to you guys soon.